Hello, everyone. Good evening. We're so excited that you've joined us tonight. I am Dr. Edith Bracho Sanchez. I am a primary care pediatrician here at Columbia, and I have the pleasure of having here with me four amazing panelists. I cannot wait for you to hear from them on this topic of social media. I want to very briefly tell you a little bit about them to give you context about who you're hearing from tonight. They are really so impressive. I'm going to try to do this quickly because I so badly want to get to their expertise and all the information they're bringing to you tonight. So very quickly, we have with us Dr. Marina Catallozzi, who you see here. Marina, you can wave. There's Dr. Catallozzi. She wears a lot of hats here at Columbia. She is an adolescent medicine specialist. She is an associate professor of pediatrics and population health. And family health, I should say, here at Columbia. She also is the chief medical officer of Barnard College, and someone who's really, like everyone else here tonight, truly committed to the well-being of people. Dr. Zachary Blumkin. Dr. Blumkin, you can wave. There he is. He is also a clinical psychologist. He has treated kids, their families in a variety of settings. He is the senior clinical director for the psychiatry faculty practice here at Columbia. We also have with us Dr. Anne-Marie Albano. She is a professor and clinical psychologist. She is an expert in anxiety and mood disorders in youth here at Columbia. She has an amazing TED Talk you all should go see after this conversation tonight about kids and anxiety and how to set them up for success and helping them. And last but definitely not least, we have with us Dr. Randy Auerbach. He is an associate professor and co-director for the Center for the Prevention and Treatment of Depression. He also does a lot of other really cool work that is not on this slide tonight, but works with the WHO and in a variety of other settings. And I'm truly just so excited to have you all with us tonight. I very quickly, just for housekeeping purposes, want to share quickly that the content on this webinar is really here for general information only and should not be relied on as a substitute for any professional medical advice or treatment. And the views that we will be sharing on this webinar solely reflect the expertise and experience of me, who is your host tonight, and our guests who I just introduced. So with that, I'm going to stop sharing my screen. And I want to start this conversation. So very quickly, I think I stopped sharing. Okay. So in thinking about how to start this conversation tonight, I wanted to ground us on the biology of the adolescent brain. Of course, our adolescents are the people we care so deeply about and who we're hoping to set up for success in all of the work that we do and in whatever capacity we interact with them. So I wanted to start by asking you, Dr. Catallozzi, what do we know about the adolescent brain, about the developmental stages that the brain is going through, and how social media can impact that development?
Well, thank you so much for that question. I think it's one of the things that as a pediatrician is so important to me, because I think adults often don't think about this when they're talking to young people. So adolescence, as we define it, somewhere between 10 and as old as 25, 26, because we know that brain development continues during that time. And so 10, 11, 12, 13, that's early adolescence, even 14 sometimes. We know that there's a lot of what we call concrete thinking, not understanding sort of that one thing you do can have multiple effects. The middle adolescence, that time of strife in families, often when kids are starting to individuate, 15 to 17 years of age, we still have that frontal lobe, the CEO of the brain, that is really trying to make connections and is in battle with the limbic system, which is that sort of sensation seeker. And then 18 and as old as 26 years of age, still really decision-making can be stunted by times of stress in particularly during times of stress. Adolescent brains kind of revert to that concrete thinking, really unable to kind of protect themselves in some ways. And so when we think about this with regard to social media, we often think about Instagram, Snapchat, and TikTok, but it's really any any time that we're kind of putting media out there or receiving it in some way, things like YouTube, gaming, it's really a lot of different things. And you can imagine that interaction for a 13-year-old is going to be very different than a 17-year-old, right? So that understanding of what you're receiving, that critical eye that you can put to information that you have, or even how to interact with another person when you maybe don't have much experience interacting with people in person still. And so that's really important behind when I think about not just interacting with young people in my office, in my life, but also when talking to parents and talking to young people about social media use.
Yeah, it's really so helpful to think about it in that way, Dr. Catallozzi. And what I'm hearing is there's a lot of development going on, a lot of exciting development, but the stress has the potential to stunt some of the growth and some of the development that needs to happen in adolescence, right? And what I'm also hearing is that when we say social media, we mean a lot of different things. And some of it is interactive, some of it is not so interactive, some of it is receiving, some of it is really engaging, right? And I think to anyone in the audience who either has a teenager at home or works with teens, it's no surprise that in recent surveys, over 90% of teens are saying that they are on social media. And then over a third of them are saying that they're on social media all the time, all the time. I mean, teens are admitting this, right? So I want to go next to you, Dr. Blumkin, and I want to ask you, when we want to start with this framework of positive, negative, good, bad, how should we be thinking about this? Just help us with a little bit of framework of how we should think about it in terms of negative, positive. Is it good for you? Is it bad for you? What do you say to that?
Yeah, and this is such an excellent question. So I appreciate you asking this. I think that it's very easy to kind of demonize social media and right off the bat say it's really awful and something that's horrible. But I think actually what we see is there are some benefits from social media. And specifically when we're talking about some marginalized populations, LGBTQ populations, specifically individuals where in their in-person environment, they may not be able to get that support or that validation or and the ability to just have peers as a sounding board for their community. That's when social media can be really, really helpful. And at the same time, and I'm sure we're going to get into this later, there's a lot of risks regarding having folks on social media and being on social media for an extended period. And so that's really why we want to think as parents of talking with our children at a very young age about the risks of social media. And to Dr. Catallozzi's point, you really want to think about it from a developmental perspective. You're going to want to have the conversation with an 8-year-old if they have any access to social media. We can talk about ages, certainly with a 10-year-old, and then it's going to change as they're 12, 14, 16. And what are the risks and what do we want to be mindful of and what platforms are appropriate? What privacy settings do we want to use? And also, when do we want to give them some autonomy and independence on what they're using? So these are all aspects that you're really going to want to think about at a very young age. And I want to be kind of pretty open about that, about my recommendation that under 10 years old, you're probably going to want to keep them away from social media.
Yeah. They're just not ready, right? As Dr. Catallozzi was talking about the brain and brain development, it's just a little too soon. And all the points that you're mentioning, Dr. Blumkin, are definitely things I want to dive a little bit deeper into. I also think that this conversation about it having some potential positive effects for communities, for kids who have been marginalized in any way, it's not something to be overlooked, right? And so I want to ask, knowing that we're in the middle of a mental health crisis when it comes to youth in this country, knowing that part of the reason, something that has contributed is social media, but that we're quick to blame it for all of it, right? And I think in a very simplified discourse, we're just so quick to blame social media for everything that's happening. I want to ask, what does social media gone right look like? And Dr. Blumkin, you can answer that question as well, and everyone else, please feel free to chime in. And just a reminder for people who are listening, you can send us your questions at any time throughout this conversation through the Q&A. But Dr. Blumkin, what does it look like, social media gone right?
Yeah, this is when our teens find that positive community. They find connections with others who share identities, abilities, interests. the idea to form and maintain friendships online, to have those positive interactions with a more diverse group. This is really helpful. And again, coming back to that idea of our marginalized teens, our teens who might not be able to share those interests and abilities with the folks that are around them just because of where they are. The other piece that I kind of want to talk about is the digitally based social media mental health interventions, which you have to be careful about. And there's a lot of great interventions online, some that are a little bit more surface level and others that are actually very significant interventions that I know some of the colleagues on the call are involved in. And really that can be a great place to get access to some important evidence-based interventions.
Yeah, I love that. I want to go back to you for a second, Dr. Catallozzi, because I know you have teens at home. And I want to ask, as a parent, I mean, you're also someone who interacts with college students, of course, and who has your own patients in a very busy adolescent practice. But at home, what does social media gone right look like?
That's a great question. So I have a now turning 18-year-old who was turning 15 at the beginning of the pandemic, who, and Dr. Auerbach was talking about the ukulele earlier, actually taught herself to play the ukulele during the pandemic on TikTok. And, you know, honestly made us some beautiful dinners when I was, my partner and I were in the hospital. So, you know, that was not possible for us to cook. And so, you know, there's some really things that are, you know, that are positive there that really, and also that capacity to connect with other kids when she had just started high school. So for us, you know, again, that conversation started very early. We were really careful about the social media we were using. We also sort of did what I like to call metacognition and medical education, which is if I'm using it, I say, you know, you know, we had such a lovely day together. Look at this picture. Does everybody feel comfortable with it? I think I'm going to go ahead and post it because, you know, aunties in Rhode Island hadn't seen this picture yet, and this is a good way for them to see it quickly, right? Sort of explaining things, and so being really open about it. But that's what positive looks like for us. And another piece for us was that recognition when she was using it too much, and during exams she would say, okay, a week before, I'm going to go off, I'm going to take TikTok off because it's a time sink for me. And then we would check in, did you take it off yet? Yes. Okay. And then at the end of exam period, she would go back on. So again, it's that open conversation we were having, and also a young person who we knew how to self-regulate, right? So we knew she could self-regulate, and that was really important. But at 13, could she have self-regulated that way? Not sure. At 15, 16, 17, she was able to do that.
Yeah, super important context. We have a question from one of our audience members. Dr. Blumkin, you mentioned successful mental health programs that have been, you know, happening online. What makes them more than surface level is what this participant is asking. You know, and I'll pose that question back to you, but really anyone who has experience establishing or working in some of these programs, please feel free to chime in.
Yeah, I'll keep it brief so our other panelists can speak as well. I mean, I think that there's sort of three, I guess, general thoughts that I have on this. The first is on the more surface level, a great website is effectivechildtherapy.com. This talks a lot about evidence-based practices for children and adolescents. It's easy to access online. It's a great resource for parents to utilize. Then if you think about specifically for dialectical behavior therapy, there are some amazing videos on mindfulness that our friends at Rutgers have done that are really built for our teens and our families. And then there are actual evidence-based treatment facilities that are fully online, that utilize online platforms that are out there that folks can have access to, which increases accessibility of those evidence-based practices, which is so important. So really, there are some significant benefits of using an online platform in many different ways.
And if I would just add, for just quick, very good psychoeducation and an app that can help you with deep breathing and various things, look above the border up north. The Anxiety Canada is a phenomenal association that developed years ago Mind Shift, and it's a free downloadable app, and it leads you through a lot of evidence-based strategies for cognitive behavioral therapy and approaches to dealing with stress and anxiety.
I think these are great comments. The only thing I would add is, sometimes surface level is the right level. I think that, the social media crisis, if we should name it that, I don't know, should be understood in the backdrop of kind of a mental health crisis in the context of a shortage of clinicians, which I think proportionally is probably a greater driver of the mental health crisis than social media. And I think what's nice about a lot of these tools is that it provides for many an only step, but for others, a first step to kind of get integrated within the mental health field in an approachable, accessible way that's on their terms, on their time, which I think for many in terms of understanding, fostering motivation is really critical.
Yeah. Thank you all for all of that, and for our participants who ask these questions and who are asking us to type in the chat some of these resources. We're going to compile all of them and we're going to deliver them right to your inbox, because we know that this is a busy time and people are probably multitasking, and we're so grateful that you have joined us. So do not worry about taking notes, and do not worry about keeping track in the chat. We will be delivering all of this back to your inboxes, because you registered with your email when you registered for this webinar. So I want to transition, Dr. Albano, back to you to ask a little bit about who is most at risk for some of the negative effects of social media, because we're talking about the positive, and there's definitely some, but we have to be realistic. I think all of us as practitioners, parents at home, know this. There are, of course, negative effects. We'll talk a little bit more about what those are, but I want to start by asking, who's most at risk for those negative effects from social media?
Yeah, we want to think about this, and there were studies that were done several prior to the pandemic that showed and demonstrated that youth who spend time on social media and do not spend time in face-to-face interactions, doing things with peers, doing things with adults, whether it's teachers, coaches, and engaging in productive and fun and relaxing activity in a face-to-face way. Those are the kids who had more trouble due to social media. And what we're looking at there are when you have youth who specifically have social anxiety disorder. This is, they feel so overwhelmed with anxiety, thinking they're going to be negatively evaluated, rejected, humiliated. Maybe they've had histories of being bullied by others. They're more likely to flee, a lot of these kids, into social media and then lose out on developing real relationships. We also see, of course, a lot of youth with, for instance, eating disorders, depression, feelings of hopelessness, suicidality, who go into social media to find sites that confirm their negative feelings about themselves, especially negative feelings about body image, self-harm, and various things. So we have to look for these youth who are at risk because of different kinds of mental health issues that are going on with them. That makes social media sort of a vortex for a negative spiral of reinforcing those negative images and ideas about themselves.
Yeah, I think that's so important for the practitioners in our audience, as well as the parents in our audience. And we're going to talk a little bit more about how to start this relationship with social media and some warning signs and some supervision. But before we transition to that part of the webinar, I do want to ask, when we think about some of these negative effects, right? You just spoke about who is most at risk and who we really should be keeping an eye out for as practitioners, as parents, as people who interact with teens. But I want to go to you, Dr. Auerbach, and ask a little bit about the data, right? Because I think, you all have so much expertise and experience on the ground. I also would love to pair that with, what is the data saying? What do we know for sure about what really happens in some of these negative effects?
Yeah, it's a great question. And I think that there is no doubt in my mind that negative social media exposures have contributed to unfortunate outcomes in many instances across anxiety, suicidal thoughts and behaviors, depression, and the list goes on. At the same time, the quality of the research that has been done, not said with any judgment, just kind of in the nascency stage that it's in, is really superficial. Most of it has relied on self-report questionnaires, so having teens report back on their behaviors. And it really is a disservice to the nuanced approach that social media is, in the sense that, how they're engaging passively, actively, how that differs as a function of platforms. Are they engaging in social media in their true voice? Is it kind of a pseudonym for who they are? And so on and so forth. It's not taking into account the type of content they're actually viewing, the interaction online, and so on and so forth. And so there's been a lot of strong statements made about social media causing depression, social media resulting in suicide. And I think that this is a byproduct of some of the things that Anne-Marie alluded to, wherein there are a number of cases in which people are information seeking about certain methods, certain behaviors. And you could, of course, find that online and social media, but you could also find that on the internet, writ large. And I think that, Zach said it really, really well, in the sense that we have to look on balance. What are the positives that we could offer? And what are the positive receipts, particularly in marginalized communities? And does the positive outweigh the negative? And we could take this into account, capitalizing on a lot of the other themes, that really what is needed is better guidance, meaning teaching our youth to better utilize these instruments, these methods, these approaches online. But I think what's also important to note is that their online presence is often a mirror of what's happening in their world. And so, for example, there's really good data to show that people who, teens that have been reported being victimized online have also are more likely to be victimized in real life. Teens who are more likely to victimize others online are also victimizing people in real life. And so I think that what this underscores for me is the importance of being present in our teens' lives, given amidst all the other distractions that adults are actually facing, and ensuring that they're getting access to services that they may need earlier in the developmental course of kind of emerging or budding psychopathology.
Yeah, it's such a nuanced picture right now, right? And the data definitely, and I appreciate you so much for highlighting that. Dr. Auerbach, that has limitations. The data is not perfect, and we're all sort of doing our best based on the data that we have. I want to pause for a moment. There is a question that came in about the impact of social media on young brains. I wonder, Dr. Catallozzi, if you can recap a little bit of what you said at the beginning on the impact of social media on a developing brain, and a brain that's still undergoing so much growth and development.
I mean, I think what's important here is that and this gets to Dr. Auerbach's comments, which is that we don't really have any data behind it. We have a lot of assumptions and presumptions and sort of associations, right? And what we know is that, again, self-regulation is part of the development of the adolescent brain. It can also be interrupted by things like ADD, and that each person develops at a different pace and in a different trajectory. And I think there's, again, a lot of assumptions that it can't be good for kids because they're going to get addicted. Again, a lot of that has yet to be proven. What we know, though, is that, if someone's going to start at a younger age, they need to be supervised. We need to limit their time, and we need to process and talk about what's happening. And that's the piece that I think often is not happening when, if a family assumes like, well, everybody else is on social media, I don't want my kid to be that one kid that's not, they're going to be left out. It's more kind of what's right for your child, for your family. I see a lot of questions on here about what's the right time, which is the best app. I think, using things like commonsense.org, which is a really wonderful tool, not just for movies that are appropriate or not, but having a family really understand what is Snapchat. Like, does it really just go away? No, it doesn't. Like what are you actually letting your child interact with, and what kind of tools can you actually put in place the earlier you do that, the better, because if your child or teen knows this is how my parents do it and I'm going to be supervised, that's sort of something that can go away eventually or can continue, but at an earlier age when, you can explain to them, look, you're young, you're interacting with this stuff, I'm going to be watching and I'm going to be talking to you about it, and if it's not working out, we're going to pull back. That's a lot easier to put in place at 14, 15 years of age than at 16 or 17. I hope that answers your question.
Yeah, no,
Can I
absolutely.
also just say something here to just go right on top of what you're saying, Marina? If parents also can try to work from the time their children are young with the idea of grandma's rule. And grandma's rule, translated into psychological babble, is the PREMAC principle. And that is, first you do the things you're responsible to do, your homework, your chore, have meals with, and then you use the social media or what television show, whatever it is that you want to do to reinforce yourself. Not that you put, it's first you eat the spinach, then you get the ice cream. And if they teach kids that from their earliest ages on social media, that first you do the responsible things, including first you go out and play with your friends and shoot hoops or, go to dance class or whatever it might be, then you have time on social media. Then they're not just learning that social media is my entire world and what I need. All right. So that I just want to throw that there because it made sense after what you were saying.
Absolutely. And I think that kids pick up on hypocrisy immediately. And if you as a parent are like telling them to put their phones down during mealtime, they're gonna be like, well, you're doing it. So, things like a family docking station and and I too have to, have my spinach before I have my dessert. So I think that's right, Amber. Absolutely.
Yeah. And I think what you're both mentioning here applies to so many things in parenting, right? I mean, I have a toddler. I'm still a little bit away from social media, but it applies to so many things in parenting, right? And I love that you're bringing that context back into the social media conversation. I want to ask one more question that came in from our audience, and it came in, Dr. Auerbach, as you were talking about some of the data and some of the things that we know about the negative effects of social media on teens. And it is really, do we know anything about certain platforms being worse than others or certain platforms being better than others for teens? And specifically when we're talking about some of these negative consequences.
Yeah, I'm going to give an answer that's going to be wholeheartedly unfulfilling, unfortunately. The reality is that you're a unicorn if you're using one social media platform. Most teens are using 3, 4, 7, 10 different platforms, often at the same time, literally at the same time. And so it's not really that, one platform is worse than the other. And it's also going to vary as a function of a teen's age. Fads of social media platforms rise and fall relatively quickly, as we all know. And so, again, it really gets back to this point of, kind of what Zach has also said, do you know what your teens are doing on social media? Do you know who they are interacting with? Is this an ongoing, ever-present conversation that you're having? Are you able to view the content that they're seeing? At certain ages, do you have the passwords to those platforms? That's less appropriate at maybe 16, 17, 18, but it may be, in some families more appropriate at 11, 12, and 13 to kind of see, what messages that they are sending and both receiving. And so I'm not naive. I understand that this is an enormous amount of effort, an enormous amount of time. But I also want to underscore that the costs are great. And it kind of, maybe this is dating me, but I remember when I was growing up, we had one phone in the kitchen. This is a landline. Henry understands this. And the nature of that, which is kind of a philosophy that I think is important from a parenting perspective, is that the conversation that I was having with someone they may or may not know on the other end of that telephone, everybody was listening to my side of the conversation. And so it moderated what I would say and presumably what the other person is saying on the other side. And I think that we obviously can't take an exact approach like that in the context of social media, but I would say that we can't not take that approach given what they can be exposed to at any given time.
Yeah. And what I'm hearing from you is sort of a way to approach it and a way to think about it, right? Like rather than which social media platform is better or worse, because unfortunately so many of our teens are on several, sometimes at the same time. And
Surgeon General's report and advisory, which I'll just speak for myself. I think both of these advisories are helpful in giving us solid information on how to handle this explosion in social media use among teenagers and younger kids, right? And so I really like the APA's kind of report in reflecting on different ideas on how to reduce the risks of some of the exposure. Something that we haven't talked about is the kind of the race-based hate that occurs on there, right? Again, targeting our marginalized teens. That's something that's happening across the board, and all families, all folks on the front lines, they need to be aware of that. The ongoing problematic social use regarding, being targeted with cyberbullying and things of that nature. So what I personally like from the APA health advisory, just to wrap it up, I think is it gives us a lot of ways on how to minimize some of the risks. And that's really what we want to think about as parents, as well as a lot of the folks on the front lines who are supporting the parents out there and trying to minimize some of the psychological harm.
yeah, and it's a lot of the things we've been talking about so far in this webinar and that are touched upon on this health advisory. And we will be sending it out again in a follow-up email after this webinar, along with with a link to the Surgeon General's statements. I'll pause for a moment. Does anybody else want to say anything about those two things? We have the time if you do, but if you don't, it is okay. And we will move on to the next part of the webinar. All right. So I think, I do want to get into some of the practicalities, and I'm realizing that there's a few questions in the Q&A that we haven't gotten to. We will get to those at the end. But I do want to get into some of the practicalities, right? And really, what does it look like to set our kids up for success? For those of us who are looking at this and saying, gosh, social media is everywhere, it is here to stay. So I'll go first to you, Dr. Catallozzi, and ask, what is the right age to even begin to consider this? And what are some skills, some tangible skills that we need to be looking for kids to have before we allow this to come into our lives?
Yeah, I think this is a challenging question, right? And I think I saw something about this in the Q&A as well, where just because everybody's doing it doesn't mean your child has to do it. I think that's really important. I think you want to look at the child in front of you. A lot of the apps have a cutoff of 13. So if the first thing you're doing to introduce your child to one of these apps is lying about their age, there's a problem, right? So I kind of almost think that's at least a safety net. But 13 still is quite young to see some of the content. And I think, Dr. Blumkin, you talked about, some of the algorithms, again, some of the racially problematic things that people see, some of what's built in. We've seen a lot about girls and body image recently, or those who identify as girls and body image, and kind of how that can impact young people. So I think, again, it's not a specific age, it's really the child in front of you. And also, kind of, can they critically view the information, and have you reviewed any of that information with them? So again, commonsensemedia.org has some really nice articles talking about, like, how do you talk to your young person about, like, what's the difference between an advertisement and a news or an article. So my 14-year-old asked for Snapchat for his birthday, and I was like, have you been reading any news? Like, do we watch CNN, but do you read any of the Times? And so he started reading the Times, right? Because he really wanted Snapchat. And we started talking about, like, viewpoints and perspectives, things like that. So really engaging in a conversation about it, and also, being able to have them come to you when they see something alarming. We talk so much about, like, oh my gosh, there's all these views of things on the news, and then you're letting your child on Instagram where they can kind of openly look at it. So I don't think there is an age. I think there's a problem with lying to put your child's to give your child an account. I think that's one problem. And I think that we shouldn't look to the folks who create the apps to give us guidelines as pediatricians or people who care about children, or as their parents. And you have to know the young person in front of you and make sure that they're able to take in information with a critical eye, know the difference between an advertisement or something that's unethical, unfair, and that also that they would escalate to you if they see something that is problematic, and that you're keeping, again, that conversation open, and that you are keeping tabs on it, and that you're openly keeping tabs on it, right? It shouldn't be the sort of sneaking into the room to read the journal. It's really, I'm going to be viewing this and watching this with you to make sure what you see is appropriate, and also that you're interacting in a way that is, the way that I think that should happen, and that it's responsible.
Yeah. No, it's go ahead.
I think that that's all absolutely true. And the one thing I just might add is to engage, your child's peer group's parents, because I think that it's important to know what platforms the other, teens are on, and what are the other kind of regulations that are being put upon the teens, and really work together as a community of parents to better regulate kind of what teens have access to, when they have access to it. Because I think that, again, these social media platforms start by bridging a connected community. So the teens that the other teens are in school with more than likely every single day. And then from there, 1,000 flowers bloom. But it starts with that close community. I kind of ironically, that's really where it begins in terms of building their network. And so I think if as parents, we're having that conversation with each other and really updating these policies, I think that that's important.
Yeah. No, and I'm hearing, teaching the social media literacy skills. I'm hearing, knowing where your child is developmentally and how much they can handle versus cannot handle, right? And knowing whether your child is at risk, as Dr. Albano had mentioned a little bit earlier in the webinar. And then I love this piece that you're adding, Dr. Auerbach, because, I had a friend, a close friend, whose entire class of parents came together and they took a pledge to not allow social media in their kids before a certain age, right? And it was just, parents coming together in the best sense of the word, right? Like that is like when it really works, when you really can have a lot of power together. And so thinking about that is another really important suggestion. I want to go to you again, Dr. Albano, and ask question of supervision, because how should we be approaching supervision early on? And Dr. Catallozzi was talking about how she's approached it in her home with her teens and how that's changed over time. But at the beginning, how should we approach supervision, and what does that look like a few years later?
Okay, well, actually, I want to take Marina and just put her out there talking to every parent that comes through the clinic. But, this goes to also what Randy was saying too. First of all, how to approach the supervision. It would be really helpful if communities like parent associations and schools got together and taught social media literacy from the beginning, not just to the parents, but to the kids, from the time when they notice that kids have to get online to get their homework or upload things. This is earlier and earlier happening in schools, and kids who are 7 and 8 years of age who have to be online. So we have to start it when they're young. I think one of the biggest things to do is when a parent is setting this up, to start having the technology discussion as early as possible. And that means helping your little ones who may be 3, 4, and 5 and want to listen and watch Baby Shark hour after hour or whatever they're watching, to teach them that there's a time for that. And this is, again, first you eat your spinach, then you get your ice cream. And you don't get ice cream every day, all day, after every meal. You only get it once in a while. It's a special treat. So you've got to have those conversations and set the limits early on. I think one of the biggest things that parents have to get a control over is their emotional reaction to social media and the social media their kids are consuming. Because what happens is they try to have the conversation after the horse has already left the barn,
Right.
and they're doing it with a high level of intensity and emotion and negative judgment and criticism.
Right.
And that's going to turn off your child, whether they're 10, 15, or 20. They're going to just shut down on you. So we have to go into it with not judging and saying, hey, tell me about the social media you're using. How is that working? What are the things you like about it? Where are times when you get stressed? Because I know with me and the media I'm on, it stresses me out to see this and that and the other. What do you do to manage? And so you engage them in a discussion. And I think also another thing we've seen with a lot of our parents is don't blame your kid for what other kids are posting. You also, this is another thing, like, how can you be friends with that person and you need to block them and blah, 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 because they posted this, that, or the other. And you really have to say, well, let's, again, wow, that hits me differently probably at my being your mom than it does you. What do you see and think about that? Because with me, it's different, but help me understand. Is there an acceptable aspect to what you saw? What do you think for you? What do you think the consequences over time are? So I think these are some of the things. Here's the big thing is if you can trust your child, you have to let them know that and give them room to be trusted by more freedom as time goes on. And if you can't, it's not, all right, all social media is stopped. It's all right, we have to talk about how you're going to earn back our trust, and you're going to keep monitoring while their trust is earned back, or your trust is earned back.
Yeah. No, and go ahead.
No, sorry. I think that these are great. And I would kind of double down and say that these are conversations that we need to be having, in school. Teachers need to be kind of talking about, appropriate ways to engage. They need to be having conversations about early warning signs in terms of, phishing and things of that nature. I mean, I have a 5-year-old daughter who's already doing active shooter drills. Now, is she more likely to be exposed at some point to an active shooter in a school? Gosh, I hope not. Or negative content online. And so we're investing our resources, and I'm not saying we shouldn't, into these types of safety procedures, but we're doing it at the cost of not actually taking common sense measures. And I would actually say, in terms of people on my side of the aisle with regards to psychologists, we need to be better bringing this into the context of therapy, understanding, what platforms people are engaged in, how they're communicating and interacting online, what their motivations are. And I would also argue from a pediatrician perspective that this should be part of the wellness checkup, whether it be the annual wellness visit in terms of understanding kind of their social media behaviors.
Yeah. And I can tell you that it is for both myself and for Dr. Catallozzi, who are here as primary.
I wasn't calling you out, I promise.
But no, I think you're making a really good point that it's really on all of us, right? And I think the common sense measures include, having the discussions with schools and coming together as parents and really sort of, setting them up for success at the beginning, and also having these conversations about the what ifs, right? And I agree with you, Dr. Auerbach. I think in the past, when a child has been bullied online, right, by classmates, the what ifs hadn't really been discussed ahead of time, and schools haven't known how to deal with that, right? Like the schools haven't necessarily always known how to respond to some of those things, and I think it's just so important that we engage them.
But I also think it shifts the sole responsibility from the parent having this kind of standoff and power struggle around, you shouldn't be on TikTok for this many minutes. Okay, well, we set a 60 minutes. And so now it's 61 minutes. Now they're getting it from multiple spheres with a uniform message saying, everything in moderation, balance, eat your spinach, all of these kind of messages that we're trying to convey that I think are important. If it becomes this kind of unilateral message, my parent doesn't want me to be on social media, it's a really hard song to sing. And I think that we need to beat another drum.
Yeah. And I think that gets to some of the questions also that came in through the Q&A, right? Like, I feel strongly that I don't want my daughter to be on social media yet, but other kids are on it, right? So those discussions become so important ahead of time. And I want to also just be mindful of what we're looking for when things don't go well, right? Like in an ideal world, we've done this preparation, we've laid the groundwork, we've really, our teens, our kids know what to do when they encounter something that is unpleasant, that they don't feel comfortable with. Like in an ideal world, we've done all of this. But what do we do, and what are the signs we need to be looking out for as both practitioners and parents? And I'll go back to Dr. Blumkin, to you. What does it look like when social media use is becoming problematic? And what are the warning signs that something's just not right?
Yeah, such an important question, right? Because this is going to help us identify that there's a problem and we can differentiate between normal use, right? So one is that tendency that adolescents don't want to stop or can't stop. And even when they realize it's interfering with academics, social relationships, family relationships, a tremendous amount of effort to stay connected to having that access to social media on family vacations, for example, even the kind of strong cravings to need to use it or spending more time on social media than they intended to, as well as kind of lying or deceptive behaviors to retain access. And then of course that disruption in academics or relationships in their lives. If you're having any of these, it's a sign that things are probably not going in the direction that you want them to, and maybe recalibrating the system around what is healthy social media use. And everybody on the panel has done such a nice job about talking about this in a non-judgmental, validating way. This is a part of our teens' lives, whether we like it or not. We want to validate that even our fourth graders, as the person made the comment about, they're using it as well. So it must be really difficult for a teen here, I'm going to have to limit this. And as a healthcare provider, I'm going to fully support that we do need to limit this. We need to be aware of these problematic signs if we're going to really support our teens.
Yeah. And you're getting to some of this, and Dr. Auerbach, you had also talked about it a little bit. For you, Dr. Catallozzi, how do you ask about it in your practice? And what do you recommend for the practitioners in our audience?
I think one really important piece, it's interesting, in 2018, there was a Pediatrics editorial that said, we should be asking about social media in our visits. And there was a big piece on Good Morning America. And that's how little time has passed since now everyone needs to be asking about it. And it sounds like not just in the pediatric office and adolescent medicine visit, but with psychologists and psychiatrists as well. For those of us who are pediatricians, we use the HEADS or SHADES assessment. I like SHADES because it starts with strengths, and just add another S on it with social media, asking about home activities. Again, this is an interaction that the young person's having. So just like you ask, how do you spend time with friends? What school do you go to? What is school like for you? I will often ask, how often are you on social media? How much time are you spending? Which are the apps they're using? Why are they using it? And what do they like about it? What have they seen that's upset them? If something bad happened, who would they talk to? And I think one that I ask, especially for kids who are 15 and older, and this is just what you got to, Dr. Blumkin, like, do you think you're spending too much time? And kids know when they're spending too much time. Is it actually interfering with when you want to see someone face to face? Like, you could actually go out and be active in playing sports or seeing a friend, but instead you're staying in and you're on social media because you lose track of time. Does it interrupt sleep is also a really big one. Things that interrupt sleep are automatically problematic. And I can't tell you how many young people will tell me that they sleep with their phones near their head, and then they'll wake up to an alert. And really being able to talk to families about really implementing a family docking station. And, people look at me and roll their eyes. It has to be done, because if your phone is if you're not on call, like some of us are, and your phone's near you, it can wake you up all night. And there's nothing worse for teen development than poor sleep. In terms of when we talked about brain development before. And to me, that's a real sign that something has gone wrong. So those are the questions I ask. And again, asking early, again, we all want to have our private time with young people to ask those personal questions, but even earlier, 10, 11, you can ask with the parents there, what's the family approach to social media? How are you thinking about this? That kind of thing.
Yeah. And a follow-up question that came in through the chat, how do you advise families who perhaps have cultural differences where perhaps that communication about social media and other aspects of teens' lives is perhaps not as open. How do you advise them to talk about social media? How do you help those families, those caregivers, parents build bridges with their teens?
And even those perspectives are important, right? I think that as someone who grew up in a family that was not from this country, often the rules were a little different for my family, and while it may not have been like modern communication, they explained why they were different. And that's really important. Like, this is why we have this perspective in our family. And this is the perspective we're taking, and this is the way we're going to approach it. Even that can be really helpful, even if it doesn't end in the way that the teen wants it to, being clear about why, as opposed to like, it's just a rule that you have to follow. That's, I think, really critical. And again, giving everyone the same information. A lot of the common sense media can be found in different languages. Some of the family media plan that I think we'll talk about is in English and Spanish. Again, giving options to people, but really explaining to a young person why. And sometimes as the provider, you can help to bring that conversation along. It might be helpful for Johnny to hear about why you're concerned about social media in your family.
Yeah. And we're in the role of facilitators when we do that work, right? And the hope is that it goes well and that families receive it, but it's meeting them where they are. And there's another question somewhat related that came in through the chat, and I'll go to you, Dr. Albano. There are many challenges to follow some of these methods and rules when children go up between two households following divorce or separation, and parents or caregivers who may have different parenting methods. How do you address these differences and sort of come together for the best interest of children?
That's a great question. And I think, Randy, you put something in the chat about that too. But the thing we want to look at there is bringing the members together, the caretakers, parents who are divorced, where there's multiple sets of parents, grandparents, or others who are caretakers. What you want to get everybody sort of in the room, if you can, and to say and think about is, what do they want for this child? What are their hopes and what are their goals for this child in the right now, in the here and now, through this year, over the next several years? And where do they want to see this child develop and go in their lives? Because everybody wants the same thing. So what we then have to do is say, okay, you all want the same thing, but you're going at it in different ways. And the different ways you're going at it, you allow social media all night, every night at the table, you don't. It's stressing your child.
Yeah.
It's causing upset because they're split in this way with not having a consistent, coherent, and really child-focused or teen-focused approach here. It's more about you all sometimes fighting over what you want versus what's best for your child. So this is what I do in a lot of mediation with families where we do have multiple caregivers or we have split, different homes that the child's in, is put aside whatever your thoughts are really about what you want and you do. Let's focus on what this particular child growing up with maybe anxiety, ADHD, whatever it may be, what is best for them in terms of social media use and supervision and the amount of time they should be on and such. And let's get together and agree to that plan and all sign on to it.
Yeah. Dr. Blumkin, I know you do some of this work as well. I want to go to you as well to chime in on this.
Yeah, I mean, Anne-Marie brings up such an important point, which is we want to try co-parenting, right? We want to try to get everyone together. And sometimes I think we can all acknowledge that there's a partner that is not wanting to engage in co-parenting, that is not wanting to set these limits, and it has different values and beliefs. And I want to convey and impart support and confidence in the parents that do want to use these strategies, because what you will end up finding over time is that the teens will respond more positively to you in the end. In the beginning, they may not, because they'll say, oh, so-and-so lets me stay up late and I can do this and that. But what they'll notice is they're not feeling so great in the mornings they wake up over there. And they're feeling a little bit more emotionally dysregulated and a little bit more uncomfortable and not getting their work done. But when they're staying with you, they are feeling well. So whenever we can, co-parenting, getting everyone together, I completely agree with Anne-Marie. It's the number one way to go. And sometimes it's really about you taking a stand and abiding by those kind of evidence-based guidelines that are really outlined pretty nicely in the APA advisory as well as in the Surgeon General's advisory.
Yeah. You know, and I'll just say from a general pediatrician perspective, before our patients or maybe at the same time that they're engaging with our wonderful panelists as clinical psychologists, as a general pediatrician, sometimes it's really as simple as get the other parent on FaceTime, right? Like take the time so that everyone's hearing the same message. So you don't hear it secondhand from the parent who brought the child into the appointment, right? I want to ask, oh, I think we can squeeze it in. I think we can do it. Because I think there's a good question that came up in the chat. Going back a little bit to the data, and maybe Dr. Auerbach, I'll go to you for a little bit of a quick answer on what the data says about the attention spans and what social media and the TikTok world are doing to the attention spans of teens, knowing, of course, that we've had a rise in ADHD and other conditions.
Yeah, it's a great question. You know, so I think that there are some data to certainly support, you know, diminishing attention spans. But I would say that's not just teens, that's also adults. You know, kind of this tip of tongue phenomenon has become more ever present in the sense that, oh gosh, I remember that. Oh, you know, I'm gonna Google it. And I think that it's not just a teen phenomenon. I think it's easy to point our fingers at the teens, but again, I think the ethos of the answer is essentially everything in moderation. I think that if, you know, as some of the panelists have said, we put our phones away at the end of the day, we have regulated use, we have a balance of activities, you know, we take care of our responsibilities. I think that on balance, it's not that social media is kind of generating this diminished attention span. It's kind of overuse of any one thing. You know, before social media, you have to remember it was video games. Video games were diminishing attention spans. And before video games, it was, you know, the radio. And before the radio, it was the record player. And so I think our penchant is typically to blame some newfangled technology for the mental health struggles that we have.
Those Walkmans of the 80s just introduced all of this mess.
Sony Walkman ruined me.
Dr. Catallozzi, I'll close with you. Very TV style. You have 30 seconds to answer this. What do you think? What do you think when we are asking for change from some of these social media platforms? What are the top things that should be on our list as we all advocate for some of these changes?
That's a great question. And I think, again, we have to look broader than the social media companies, because remember, these are companies that are gaining from social media use. And I know like a few years ago, Facebook was going to put something for younger kids. I think it's clarity around parental oversight and making it easy for parents to be able to use that oversight. Because I think you have to dig pretty deep to get it right now. And I think that's critically important. I think there's a few bills out right now looking at actually being able to validate a kid's age. And I think that would be helpful probably for parents as well.
Yeah, perfect. Well, I truly cannot thank you enough. I'm so grateful for everyone that joined as well. A quick shout out that you can follow us at Kids at Columbia. We are on social media very appropriately, really trying to spread good information. And we also have a new podcast out as of last week. I have interviewed 2 out of the 4 panelists here tonight for this podcast. And it is such a wonderful forum to continue some of these conversations, and I hope that you guys will find us. You can scan this on your screen right now. We will also send you a link when we recap and send you some of the links and resources that we discussed on the webinar today. And we're really just so grateful that you took the time to join us tonight. Have a good night, everyone.
Thank you. Good night.